Hello and welcome to this week's What Were They Thinking? First, we need to address the COVID-19 conspiracy theory. No, it is not a combination of SARS and HIV. This entire mess is the result of a fundamentally flawed and misunderstood study. It basically said that there were 4 genes in the COVID-19 genome that were the same as or very similar to HIV. This is being taken apart by a very good thread on Twitter by someone who is a virologist, evolution and immunology expert. They explain that the 4 protein spikes on the outside of the COVID-19 virion are there both in the COVID-19 strain and in a number of other SARS family viruses. There is nothing unique about it in terms of its presence. And this is core to the issue. The study did not find what they think they found, as a lot of it is artifacting, alignment issues, or already there. We're not discovering anything novel or inserted into the COVID-19 genome. We're just describing what is. What isn't describing the current situation are the concerns the new coronavirus from Wuhan might well become seasonal and endemic, similar to the flu. Like influenza, the coronavirus may be here to stay, with it increasing during autumn and winter and receding in spring and summer. This is not good. As it stands, humans are a very effective reservoir for disease. And one opinion coming out of the Johns Hopkins Center for Health and Security says that with its current status, it might become endemic in humans, even with a vaccine. The reason this is a concern is that in the Northern Hemisphere, winter is when the disease spreads, but as the Northern Hemisphere comes out of winter and into spring, the Southern Hemisphere goes from summer into autumn. That means there is always half the planet in a situation where it will either be increasing in the disease's presence or decreasing, but there is always some kind of equilibrium. It ensures that the disease will move from one half of the planet to the other throughout the year. The same thing could well occur with the new coronavirus. This is important to keep in mind, especially now the World Health Organization has backtracked on some of its past statements. Previously, it has downplayed the significance of the Wuhan coronavirus. Now they are saying that rather than a figure of about a 2% mortality rate, it may be as high as 3.4%. Compare this to influenza, which has a 0.1 mortality rate. There is a 20 to 34-fold difference in how much risk this presents to the wider population. Imagine what would happen if this became endemic. The World Health Organization's decision to revise how dangerous they consider the Wuhan coronavirus stems from a variety of factors. Some of the more significant ones are that it has a lower transmission rate between those who have been infected, but it also has that higher mortality rate. As has been said repeatedly, that is an issue for those who are extremely old, extremely young, or who have comorbidities, as they are more vulnerable. Other news related to the coronavirus has given rise to the belief that it is possible to not only have the virus transmit from animals to humans, but back to animals. Preliminary evidence for this primarily comes out of Hong Kong, where at least 2 cases of dogs being infected by their owners have occurred. These animals have been put into isolation for 14 days to see what is happening. What they have so far noted is that the animals have tested positive for the disease, but they are not showing any symptoms. This means there's an ongoing low level of infection. In theory, it would mean that animals could possibly wind up infecting their owners if the owners were originally infected. This, along with the possible recurring infections of those who were already infected by the Wuhan coronavirus, and it will not go away easily. It is perhaps this last point that is most telling, especially in America, where the government has had a lot of trouble responding to the outbreak, primarily in the CDC's handling of testing for the Wuhan coronavirus. A number of institutions, health departments, and even hospitals have made clear that they are not happy about how testing kits, responses, and the bureaucracy are dealing with it. It all comes down to the way the CDC decides to issue test kits. Unless you fit into a specific and very limited scope, they will not issue the test kits easily. A case then needs to be made to have the test kit put out there. In one instance, a patient was transported between multiple hospitals. After he left the first facility, it was found out that a number of staff there had been infected with the Wuhan coronavirus. Staff in the new hospital were put on administrative leave and self-quarantine in order to prevent them from possibly infecting more patients or staff. To top all of that off, the hospitals have been trying to institute proper protective policies and procedures to ensure that staff are not infected by an unknown carrier of the disease. The CDC has made all of this that much harder by making test kits harder to access, therefore diagnoses are down, and staff are unknowingly put in danger's way, even with these policies and procedures in place. Not knowing that a patient carries the Wuhan coronavirus puts the staff and other patients at an unacceptable level of risk. In less depressing and downbeat news, a CRISPR trial for blindness has been conducted and, depending on the outcome in a month's time, could possibly provide a treatment for a number of heritable disorders. Staff from the Oregon Health and Science Institute were able to inject fluid into the eye of a blind patient. This is meant to resolve their condition by changing the genome. If successful, it could be an extremely useful technology for not just heritable blindness, but other conditions that can be treated in a similar manner. A month after the procedure was completed, the doctors will know how viable and effective the treatment is. If it is showing promise, there are up to 18 more patients with the same condition who could be treated and establish a protocol. Then we have a number of case studies this week that, in various ways, demonstrate the good and the bad. First, why you should not use cotton buds to clean out your ear, which comes from a 31-year-old male who wound up with a brain infection after using cotton buds. He came to the hospital after seizures, confusion, drowsiness, and an altered state of consciousness. He reported that he had felt headaches and nausea for several days, and occasionally had memory lapses. The biggest red flag should have been the intermittent left ear pain and hearing loss for 5 years. What they identified after putting him through a CT scan was a pus-filled abscess in the tissue around his brain. This was traced back to his ear, and the infective bacterium Pseudomonas aeruginosa, a relatively common pathogen. They postulate that the infection got into his brain via the small amount of cotton bud they found in his ear canal, which could have been there for years based on his reporting. After a copious amount of antibiotics and removing the small amount of the cotton bud, he demonstrated a relatively full recovery with no adverse neurological effects remaining. Next is a slightly more bizarre case study of a 32-year-old man who presented to hospital after getting prolonged erections after consuming cannabis. This is the opposite effect that is normally observed with marijuana-type products, where erectile dysfunction is seen. Rather than that, the man reported that several times in the weeks leading up to his presentation, he had used cannabis and had had a long-lasting erection of between 6 and 12 hours. He reports that this was occurring when he was a teenager. He reports that he ceased using it in his 20s and recently resumed use of the drug. He found that both as a teen and in recent time, this had led to the issue of uncontrolled erections that did not go away. The doctors tried to understand what was happening, and their hypothesis is that somehow or other, the THC in the cannabis was activating the cannabinoid receptors. This led to vasodilation and the erection. What they couldn't figure out was the exact underlying mechanism by which it occurred. Unfortunately, they were unable to continue follow-up with the patient after they left the hospital. The final case study this week regards a 37-year-old male who, it was thought, had an impacted or hidden tooth, that is one which has not come out of the gums, and this was what was causing him to experience intense swelling and pain. The obvious first port of call was to scan the area, in this case an ultrasound. What was found was a 2 centimeter long mass that was definitely not a tooth. It was in fact a calcified stone in the salivary gland of his jaw. This was removed with surgery and resulted in the pain and swelling going down. These stones are a product of minerals building up in the salivatory glands of the mouth. They then coalesce and grow in size as they slow down and block the movement of saliva. They are primarily made out of things like calcium, magnesium, carbonate, and phosphate. The stone in and of itself is not that rare, with roughly 12 out of every 1,000 adults each year experiencing it. What is unique here is the size, as a blockage of more than 1.5 centimeters is considered rare. What we don't yet understand is how they occur, why they occur, and what the process is to get them. All that can really be done is to identify them, remove them, and monitor for future recurrences. In other news that could be of interest, researchers are developing a way to create a needle-free vaccine or method that could be used to deliver other medications and drugs. One group has looked at the use of a rapidly dissolving film that not only delivers medication effectively, but does not require extended storage and can be used as an oral medicine. These 3 things are essential for transporting and supplying medications to those areas that lack the resources and facilities to store medicine appropriately. Think of parts of Africa, South America, and even Asia that are isolated, lack power supply, or lack the facilities that could be used to store medicine in a cold environment. This sort of development could be used in lieu of that. Not only do you have the ability to store it effectively, but it's far more space-saving. Vials, syringes, and everything else needs to be transported in a controlled environment, which is already expensive and difficult. But even if you were to get it to where you need to take it, it couldn't be stored there due to the environmental conditions. That's where this new development comes in, which was inspired by a confectionery, specifically hard candy. It has 3 parts that look like a sandwich: a dissolving base layer, a center which is your filling, medicines, antigens, vaccines, anything you are trying to administer as a medicine, then a protective layer on top. This development is special in that what they were trying to do would normally lead to the destruction of whatever is in that middle layer as everything crystallizes. Fortunately, their method worked around that, and through serendipitous luck, they found an old sample of what they were preparing, tested it, and realized it actually works really well. Next we have some news on Mars and the organic molecules found thereon. The Curiosity rover extracted samples of Mars from a mudstone section in something called the Gale crater. They found that there was organic molecules in this. That in and of itself is not exciting, but it is their nature and meaning. The aromatic molecules are called thiophenes. On Earth, these are regularly found in places like crude oil and coal, both of which are created by the breakdown of biological matter under heat and pressure. This would normally be an indication of something biological present at that site, at least on Earth. On Mars, there's a far higher barrier to this claim, and you need to be able to demonstrate far better than you can for Earth why you think it was created under biological circumstances. It is possible for it to occur in a reaction called thermochemical sulfate reduction, and that requires no biological participants. They were trying to figure out whether it was this or if there was a biological basis. The researchers think that there is a possibility that it was mediated by a biological process, not a chemical one. That boils down to the sulfur involved. Most sulfur on Mars is non-nucleophilic. However, what they found was nucleophilic. That can occur via the process described, or it can be biological sulfate reduction. That's something that is possibly done by bacteria. And billions of years ago, when Mars had more water, was a warmer place, and was more hospitable to bacteria, it is possible that they were responsible for the thiophenes being produced the way they are. Unfortunately, the nature of the testing by the Curiosity rover does not allow for a more definitive conclusion than what has been described, and as a result, we need to wait on the next rover to get to Mars before we can begin exploring it in more detail. As it stands now, we have evidence indicating a biological process, and possibly very simple life, but we have nothing definitive. The final piece of news this week is a further development of the organ-on-a-chip technology. It has now gone from a single organ to a relatively simple but essential version of an organism on a chip. It encompasses a number of different tissues and organs working collaboratively across a chip that allows the investigation of drug efficacy at a more advanced level than what we have previously had. It also allows us to examine the complexities of a pathology across multiple systems. It is incredibly sophisticated and important. This entire technology builds on the past methods that have been used to understand how a cell could work, how it's affected by certain stimuli, and what changes occur at a genetic level. That then went on to an organ on a chip, where we could see how multiple cell types work together. But you need to have a whole organism to truly understand what is happening. Imagine if you were to only look at the heart muscles in isolation of everything else. You could never fully understand what was happening with cardiovascular disease. To further build on that, if you were to take hypertension, you need to look at the lungs, the heart, the vascular system, and the renal system all together to understand just one method of vasodilation and regulation of blood pressure. And even then, you are not getting a full picture. This is why even an organ on a chip has never been able to fully address the problems that have been faced in research that make animal research so essential. An animal is a full organism, and we can come very close to mimicking the same pathologies in the animal as we have in a human. Creating a whole organism on a chip like this will allow us to emulate diseases and to look at possible pharmacological uses of various drugs before we ever need to look at putting them into an animal. That will drastically decrease the demands for animals in research, which is an ethical win. As an example of what they've done, the researchers were able to use existing methodologies that are well validated. They then carried out a series of growths on this chip that included the heart, brain, liver, lungs, vascular system, and colon. Each set of these cells could then be engineered into an organ that allows for the examination of the effect a drug has or a pathology has. The only downside to the technology as it stands now is its short shelf life of just 28 days. That means it is impossible to examine the long-term effects, whether adverse or beneficial, of drugs and pathologies. Thank you for watching this video. If you have found it interesting, consider liking, sharing, and subscribing.